Thank you all for being here today, and welcome to the official launch of the ARPA-H Investor Catalyst Hub. Thank you, Mo. My name is Mark Marino. I'm the Vice President at VentureWell and the Project Director of the ARPA-H Investor Catalyst Hub, part of the ARPANET-H National Health Innovation Network. Many of you in this room here in Massachusetts worked really side by side with us these past few months to arrive exactly at this point. And so this evening is really the culmination of all of that work and a celebration that you all get to enjoy with us and with our new colleagues at ARPA-H. But it is also just the beginning. This is the starting line of the work that is ahead. To truly fulfill ARPA-H's mission of improving health outcomes for all Americans, we will need to activate the potential of every single person in this room. We will need your expertise, we will need your insights, and most importantly, we will need you to help us grow this network well beyond Massachusetts to every state, every district, every territory, and every main street in this country. So thank you to all the ARPA humans and VentureWell team that made this event possible, and a special thanks to the Charm Coalition and MassBio for sponsoring all of those food and beverages you're all enjoying. So now to welcome you to this really lovely layout and space, it's my pleasure to introduce to you the Honorable Mo Cowan, board member of Mass Challenge.
Thank you, Mark. Well, hello, everyone. How are you? Thank you for being here. We at Mass Challenge are thrilled to host you in this space for this occasion. On behalf of my colleagues of the board, the entire Mass Challenge team, and Mass Mutual, in whose broader space we're in, we welcome you to this grand venue for this grand occasion. And I couldn't think of a better reason for us all to come together in celebration of the award of the opportunity for Massachusetts once again to show the world that this is the leading place for innovation, and particularly innovation in healthcare. Innovation is certainly what Mass Challenge is about, and it was the innovative ideas, efforts, and joint decision by many in the Commonwealth to come together and make the case that this opportunity should be ours, not for our benefit, but for the benefit of the greater society and the world. Many of you in this room are responsible for that, and for that you have all of our gratitude. And I am deeply grateful that you chose Mass Challenge as a venue and as a partner in this effort. You're going to hear from some wonderful speakers today. I'm not among them. I'm simply here to welcome you to this space and welcome us all together to this opportunity. Today is the beginning of something extraordinary. I can't even begin to imagine what those extraordinary results are going to be for the near and the long term, and for the many lives together we're going to impact for the greater good. Thank you all for being here. Thank you for all the things you have yet to do, but will be necessary for you to do for us to fully realize the potential, the promise, and the opportunity. Congratulations to everyone. Let's get to work. Mark?
Thank you, Mo, and again, thank you to all of the partners in this space that really made this event happen. So it is now my pleasure to introduce the next speaker, the Honorable Mayor Wu.
Thank you, Mark. Good evening, everyone. Good evening, Senator Cowan, and to all of the incredible leaders gathered here. I am so honored to be with this crowd and to be opening up the speaking program, which will have a number of distinguished guests as well. This is one of those moments, in Boston, we are often so fiercely local and so fiercely proud. We're very clear that Boston is not Somerville, Boston is not Cambridge. Tonight is an example where Boston really encompasses everything, including Kendall Square and Cambridge, and so I have that same pride. Congratulations to everyone who had a hand in this incredible achievement for the greater Boston region and for Massachusetts. Our federal delegation who made the case and advocated so hard. Our Senator Markey, I know, will be joining us, and Senator Warren, and to all of our representatives, to Governor Healy and her team. Thank you so much for the best partners that we could have in state government, and to the many, many leaders representing our healthcare and life sciences sector and mass bio leading the charge, and especially to our community members. I see Gladys Vega here, really the closer, as I hear, in this situation, and so many others. We are so proud that Boston is known nationally, internationally, as the place where history meets innovation, where for our nearly 400-year history, we've had a legacy of people coming together around big ideas that change the world, from the birth of American democracy to every major social movement in between, to inventing life-saving vaccines in the middle of the pandemic, to curing cancer and Alzheimer's and all that is going to come from this incredible endeavor. I am so excited that the initiative here has from the very beginning been centered not only around our amazing anchor institutions and the big companies and the sector that is delivering on life sciences and healthcare, but on the community members who live this every day. And having Ms. Vega in that pitch meeting, having the Reverend Willie Bodrick as part of the initiative, really emphasized, and I believe helped make the case to those decision makers, that Boston is a place where care and innovation happens in every single corner of our neighborhoods, not just in our labs and hospitals. And so we intend to keep that legacy moving forward with the collaboration, the excitement, the increased innovation that this will spark. And please count the City of Boston as a very eager partner in all the initiatives here, not only for the next big breakthroughs and ensuring that we have the talent workforce and the pipeline and the resources to deliver, but that it's felt every single day on the ground by our residents, block by block in our neighborhoods. Thank you so much, and congratulations to all.
Great. Thank you, Mayor of the Greater Boston region. Now to contextualize a little bit of the work and what we're going to showcase even later in the program is the Director of the Project Accelerator Transition Innovation Office, or PATIO, Craig Gravitz, to talk a little bit about what ARPA-H is and what we'll be doing as part of the Investor Catalyst Hub. So, Craig.
Thanks, Mark. Welcome, everybody. This is super cool to be here. So I'm going to start with a little bit of context for you. In probably like February or March, Renee and I were in our WeWork in DC, and she's like, "Hey, I have this idea for you. We have this statutory requirement to have 3 sites, and I want to do this thing where we can actually make it really useful and like really take this concept and take it to the next level." I'm like, "I got you." And I think it's the most ARPA. So if you want to know what ARPA is all about, we're here today. So in that time, we designed a really amazing capability. We competed it, and we had some really wonderful winners. So congratulations, all of you. And we launched. And to just show you the time scale that we work at, from idea to concept to actual implementation can be that quickly. And that's the speed that we have to move at if we're actually going to help people. Okay, so I want to tell you actually a little bit about what this is, because I think there's still even a little bit of confusion now. So fundamentally at an ARPA, our job is to make what seems impossible, debunk that and show that it's actually possible. So we have program managers like Darshak right here, these technical geniuses who can make these things happen. And these sort of technical solutions bring them to life. But our theory of the case is that if you create this wonderful technical innovation, but it just sits on the shelf somewhere, it's not going to matter. It has to get to people. And so what ARPANET-H is that transition strategy that's just as creative as the underlying science. And it's our way of investing in actually making things real. So just very briefly, I love human-centered design, and there's this concept that was popularized by the design firm IDEO. And it's basically, it says, like, it's this Venn diagram where innovation comes at the cross-section of three things, or the center of three things. So one is technical feasibility. That's what Darshak, Ross, and our other program managers do. They make what seems impossible, and they prove that it's possible. But then there's two other pieces to that that are just as important. So there's desirability. This is people. So this is talking about, do I trust what people are building? Can I afford it? Is it accessible to me? That's all about customers. That's all about people, the patients that we're trying to solve for. If we're not solving a problem that matters to people, then it doesn't really matter what we're doing. That's our customer experience network. And then the Investor Catalyst network that we have here, this is all about the viability or the business dynamics that like underlie everything that we do. So is there a business model? Can you actually launch this in a way that'll survive in the wild? Will it pass regulatory muster? Is there a reimbursement pathway for that? And that's fundamentally triangulating those three things is what this network is all about. And you can't get at those things unless you're with all of the innovators all across the country, and that's fundamentally what this network does. So we are going to understand the concerns of people, desirability. We're going to understand the concerns of market viability. And with our program managers, we're really going to unblock these technical bottlenecks. Welcome to ARPANET-H, and we're looking forward to working with you. Thank you.
Great. Thank you, Craig. So that was a little bit about what we're doing. And so now to take you a little bit back in time to how was it created. So it is, again, my distinct honor and pleasure to bring up one of, architects and the reason why ARPA-H is now in existence, the Honorable Senator Ed Markey.
Congratulations, everyone. What a big day for us, huh? This is about as good as it gets as a celebration. It's just pointing towards the 21st century and all of the great new things which Massachusetts is going to add, not just to our country, but to the entire planet. So congratulations to everyone. And I'm here with my wife, Rear Admiral, former Assistant Surgeon General, Dr. Susan Blumenthal. When I met her, she was the Chief of Behavioral Medicine at the National Institutes of Health, Mental Health, Depression, Suicide, and then she went on to run all of women's health in the United States, the first Deputy Assistant Secretary for Women's Health in our nation's history. And she's been dreaming about a day like today for a long time, giving those dreams to an Irish Catholic politician from Malden. Okay, so I'm so glad that she is able to be with us here today, and to the Investor Catalyst Hub here in Boston. And I want to congratulate Dr. Renee Wegerson and this incredible moment, this incredible leader who has been given this job as the first director of ARPA-H, which comes, who is going to come to the agency from DARPA, the Defense Research Agency, and from Ginkgo Bioworks, the recombinant research DNA of Boston. So we're just so lucky to have her, and I wish all my House colleagues could be here as well, but they're still down in Washington. Tip O'Neill used to say, all politics is local. Now it's all politics is loco, but it's kind of sorting out a little bit down there in the House. But she, Ayanna and Richie Neal and Laurie Trahan, they wish they could be here, but it's just not possible at this moment. And Marty Meehan, I saw right over here, hosted a great meeting that we had just about a year ago to begin to plan. And so it's just so great to be here. I've been saying for years that ARPA-H now knows this to be true, that we're not only the Bay State, we're the brain state as well. We are the world's biotech hub, literally. More than 100,000 biotech jobs are here. I am the chair of the Health Subcommittee in the United States Senate, so I know that every other member of that committee points to and asks me about what's going on in Massachusetts. And there is no better home for ARPA-H's Investor Catalyst Hub than our home right here. After all, it's in our DNA. We are the dream team for advancing health research. So here's the proof. We're just 2% of the country's population, but we represent 9% of all National Institutes of Health funding right here. We're home to 5 of the top NIH-funded hospitals. That's like having Larry Bird, Bill Russell, Bob Cousy, John Havlicek, Paul Pierce, Jason Tatum, all as your doctors, simultaneously working on problems, working on issues. And to advance that metaphor, we have the former captain of the Harvard women's basketball team quarterbacking our effort in order to win this award. So we're so proud of you, Governor, for the incredible team that you put together, the dream team, to win this incredible designation. We received the second largest amount of funding for the National Science Foundation. We're 2% of the population. California is 12%, but we're right behind them in receiving that funding. We have more than 1,000 biotech companies. We account for 15% of the US drug development pipeline, helping health providers treat cancer, brain diseases, infectious diseases, illnesses with novel therapies. We're beating nearly every other state in the growth of pharmaceutical jobs. And so this is the place to have this incredible cutting edge institution. We are the state that developed and distributed COVID-19 vaccines worldwide in the blink of a research eye, and we rolled out the vaccine at no cost across the state at an unprecedented pace in history. The partnership, the collaboration between research institutions, industry, community organizations, government officials turned theory into practice. It was revolutionary. It happened here. In short, we know what it means to turn talent and research funding into real results for all Americans. And at our best, we translate those breakthroughs into new preventative strategies, diagnostic methods, treatments, and cures that all Americans can access. We turn research into medicine's field of dreams from which we're harvesting the findings that give families the hope that we will find the breakthroughs for the families, for the diseases that have been ravaging their families for generations. And already, ARPA-H has awarded grants to Massachusetts medical schools, research institutions, companies working to address critical health concerns like antimicrobial resistance, autoimmune diseases, and early cancer detection. And just this month, ARPA-H announced that they are going to have an initiative to improve clinical trials access, participation in research that develops new treatments that will enable 90% of all eligible Americans to participate in a research study within 30 minutes of their home. That's revolutionary, because we need to have diverse participation in research equity so that scientific findings will work for everyone. That's the goal of our great mayor every day, trying to ensure that everyone is included. That is the goal that our great governor has every single day. Equity is built into everything they do every single day, and it will be built into this new, modern, forward-looking way in which we're looking at all these issues. And now, picked as one of only 3 hubs in the country, the Investor Catalyst Hub, coordinated by VentureWell, will supercharge the greatest scientific minds of our country to develop tomorrow's cures by clearing the pathway from the research lab to the marketplace. We will become the mega brain state. Advancements in healthcare mean nothing if they don't get into the hands of doctors and patients who need them. And right now, according to the National Academy of Medicine, there is a 15-year science to service gap between the time of new discovery in the laboratory and its wide dissemination into communities and in the information age. Why isn't it in a nanosecond? That's what the Investor Catalyst Hub will be all about, unlocking this potential for everyone and fast. And I have no doubt that these innovations are just around the corner. And sadly, there's a 20-year life expectancy gap in Massachusetts and across the country based upon the zip code where you live. We need to ensure equity is at the heart of these new initiatives and accelerate the speed of translating scientific findings into saving lives across all income groups, across all racial divides. And so just having Gladys Vega, great team you put together, Governor, Gladys Vega, Mariana Matas, Dr. Ann Klebansky as the team, they're like the holy trinity of healthcare: community connection, biopharmaceutical innovation, and groundbreaking healthcare providers, all working together in partnership. So congratulations to all of you. It was a team effort. We thank the governor, thank the mayor for their leadership. It's going to be a special role that we're going to play in bringing all of this innovation, not just to our own country, but to the world, to guarantee that we have a better, healthier, more equitable world for everyone to enjoy. Congratulations, everyone. Just such a pleasure to be with you. Thank you.
Thank you, Senator. And to just continue the metaphor and talk a little bit about Team Massachusetts point guard, who made everyone around them better. As soon as the news was announced that Massachusetts would be the home of the Investor Catalyst Hub, one of the first calls I got was from the governor, again thanking us for the work, which is like a good point guard, makes everyone better, facilitates credit, takes none on her own. And even this morning, being in Chelsea, in the community, as we toured La Collaborativa, and having the governor be a part of that. So it is my great pleasure to introduce Governor Maura Healey.
Well, thank you so much. Thank you so much, Mark, and congratulations to VentureWell. We are really proud, too, that with this, a nonprofit headquartered in Western Massachusetts is running point for this effort. So that is pretty cool as well. Congratulations to all of you in this room, because it really took the efforts of all of you, so many in this room and others who could not be here tonight, to bring this home for Massachusetts. And we're bringing home something that is going to make meaningful change in the course, the trajectory of people's lives here, and importantly, across the world. That's something you all should be incredibly, incredibly proud of. And I am just grateful for the work, the years and years of study, of research, of development, all that it took to position Massachusetts to have this shot and this opportunity. It doesn't happen overnight. It doesn't happen because somebody gets elected. It happens because there's a foundation there. And I think I speak on behalf of, Mayor would let me say this, I think we understand the foundations here. They're really, really special here in Boston and across this Commonwealth. And we are grateful to all who have been part of creating and furthering that infrastructure. Director Wiggerson, it's great to see you. I can't see you right now. I know you're here. Hello. And it was wonderful to be with you this morning in Chelsea. Congratulations to you and to your team in this incredibly important startup venture, essentially, that is just so exciting. Thank you for your belief in our people, in this state, our values, and most importantly, your belief in our ability to deliver innovative solutions to needed healthcare across the planet. Hosting ARPA-H's Investor Catalyst Hub is a huge win for our state. It's one we fought hard for because we believe in its transformative mission. And I want to thank all the people who made this historic moment possible through their hard work and their talent, and also their passion and their values and their perseverance that kept them at this. Senator Markey, thank you for your leadership and your vision, your leadership across so many realms when it comes to building healthier, livable communities. That extends to the work you do on climate and your leadership there, and certainly what you led here in helping achieve the creation of ARPA-H. We're grateful to your colleagues as well. We miss them. We want them back here. But I know each and every one of our fantastic members of our congressional delegation take great pride in this and see the value in this. And we're grateful that they took the action to see this was going to be funded. To Mayor Michelle Wu, who's been a fantastic partner on so many fronts. I appreciate so much how our values align, the values and vision that we have for the state, for the city, and the work of our teams align. And thank you for being a champion for the kind of innovation and the kind of inclusivity that is truly a hallmark, and I think representative of what this Investor Catalyst Hub is all about. We've got state legislators in the room. I see Ann Margaret Ferrante. I know there are probably others here, so I'll get myself in trouble. Thank you for continuing to fund life sciences. We're able to do what we're able to do in Massachusetts because we have that foundation, and that foundation remains incredibly important in the time ahead. To our team in the office, I just want to say on behalf of the Lieutenant Governor and myself, we are so fortunate to work with so many talented, engaged, energetic leaders in their own right in the office. Our economic development team, led by our fabulous Secretary, Yvonne Howe. We thank her as a longtime leader in the health innovation economy. And her entire team worked very hard. Rory, I hope you can sleep better tonight because you landed the plane. Our Health and Human Services team, led by our fantastic secretary, Kate Walsh, a longtime leader in our healthcare and hospital sector. The team at the Mass Life Sciences Center, our shining example of what forward-thinking government partnership with industry looks like. Senator Mo Cowan and everyone at Mass Challenge, we appreciate so much this globally recognized accelerator. Dr. Klebansky, it's wonderful to see you, and thank you for being here and for the work that you and your teams did in this effort. Dr. Mariana Matus, wonderful to see you again. BioBot Analytics, I didn't know anything about BioBot Analytics until a couple of years ago, but what an example of our brilliant and diverse innovators, right? Who were in the right place at the right time, ready to deploy incredibly useful, innovative technology when a pandemic hit our country. And we're delighted to see you. And of course, the great Gladys Vega of La Colaborativa, whose passion for community and track record in health equity is at the core of what we're seeking to achieve with this bold initiative. We had the chance to stand this morning inside La Colaborativa, where it was great because business wasn't shut down. There were continued to see clients and patients, and I think it was a great way to see the energy and the focus of an initiative like this in action and what is possible through this. These outstanding leaders represent hundreds more, as I mentioned, of our communities, of our labs, of our companies, of our research institutions. Special shout out, of course, to the University of Massachusetts and President Marty Meehan. We're proud of all our campuses, and I know that in the early days of this, you, along with Richie Neal, had a strong vision for what this would mean for Massachusetts, and we've managed to cover the state from Western Massachusetts right here to the waterfront, and that's what you do in education as well. They also represent, all these entities represent the open and collaborative spirit that we believe will make this Investor Catalyst Hub a success for ARPA-H, a big win, and a benefit to the nation and the world. And that is why when President Biden announced ARPA-H, we knew right away that this was something that Massachusetts was built for and that we were going to work really hard to win, and that we should win because we are a leader. We've been a leader And the times right now require a lot of leadership and the ability to get things done. And when I look across the room today, it's clear we have the leaders who understand goals and drive and vision and initiative and bring the energy to actually get things done, to turn innovative ideas into practical, accessible, and equitable solutions that will provide health and well-being to folks across the world. That's what we do in Massachusetts. That's who we are. We're that in our colleges and our universities and our research institutes, our hospitals, healthcare systems, medical labs, incubators and accelerators, our venture capital investors. Where are they? And our small businesses. Thank you. Life science giants and scrappy startups. We have it all, and we draw talent from around the globe to solve the world's toughest problems and deliver results. That's the water that we swim in. Problem solving, creativity, and collaboration. So we are proud to host the Investor Catalyst Hub. We look forward to forging relationships with established and new spokes across the country. We're committed to making most of this opportunity and delivering for ARPA-H and for America. We want to bring all of our talent and potential to bear in this work. And that's why we as a state will continue to do things like advance every equity at every step of the innovation economy, from our STEM education to college access to workforce readiness, to mentorship to startup funding. We're passionate about delivering equity in our outcomes with access to health solutions for traditionally underserved communities here in Massachusetts. And that's how I know we'll have the greatest impact, because we've done some of this before. This is an opportunity to do it on a whole new scale with a whole lot of brain power and support. And I'll leave it at that. I brag on Massachusetts all the time that, we're a state of first school, first college, first park, first library. We're also home to the first anesthesia, the first cardiac surgery, and more recently, the first mRNA vaccines delivered with equity to all of our communities during a pandemic. This is part of our DNA. As was said, it's part of our history, and more importantly, it's part of what will fuel the work ahead, the combined effort of public-private partnership, of federal and state engagement. We're just so grateful. So thank you to everyone who helped make this happen. Thank you to everyone who helped bring this home. Know that all of you in this room have a partner in the state of Massachusetts, and I wish everyone the very best in the time ahead. Thank you.
Thank you, Governor. Unfortunately, Senator Warren couldn't join, but she would like to also say remarks, and so we'll cut to a quick video and then come back for the final part.
Hello, ARPA-H. I'm Elizabeth Warren. I am sorry I couldn't be with you in person today, but I am so excited to celebrate the launch of ARPANET-H and its Investor Catalyst Hub, which will be stationed right here in Massachusetts. I know the importance of bringing lots of different people to the table to advance cutting-edge research. This effort will create a nationwide health innovation network that will spur life-changing advancements in drug development and healthcare delivery so that we can improve health outcomes in an equitable and measurable way. And as part of this network, the Investor Catalyst Hub will bring together researchers and entrepreneurs and investors to harness innovative ideas and bring game-changing health breakthroughs to market for the folks who need it most. Every American should be able to get the care they need when they need it. It's worth fighting for, and it's a goal that we'll come closer to achieving through your work at ARPA-H. So, congratulations. I am so happy to be in this fight alongside you. Thank you for the incredible work that you do every day, and even better, the work you'll do tomorrow.
Great. So now, why we're all really here, and that is to hear from ARPA-H directly. So as Craig pointed out and contextualized, let's really talk about what this is, what the Investor Catalyst Hub is, what ARPA-H is trying to do, and then hear some examples that showcase what this work is. So again, I get to introduce the quarterback slash point guard slash facilitator of ARPA-H, Dr. Renee Wegerson.
Good evening, Boston. It is super exciting to be here. Last time that we were here, we were part of a 3-phase process, the competition to determine who would be our Investor Catalyst Hub. It started with a white paper, followed by a site visit. And when we were in Boston, I would say everybody looked a little bit more stressed out than they do today. So it's great to just be here and celebrate with you. Sincere congratulations to the team. To VentureWell, really excited to be partnering with you. And then thank you to Mass Challenge, of course, for hosting us here today. I also want to take a minute to thank some of our distinguished guests. So Senator Markey, you showed me the table where literally ARPA-H was first thought of almost a decade ago. And so it was a lot of hard work through the years to make this a reality. So I'm really excited to help lead the team to do that. Of course, Governor Healy, your team, Secretary Howe, you brought the powerhouses together and really just drove to a mission that I could tell from the very beginning that we shared. So it was really seeing how we're going to collaborate in the future was the vision that you gave us. And so thank you for pushing and leading that. Secretary Walsh and of course Mayor Wu of Greater Boston, as I've learned that Cambridge isn't Boston. I'll admit I come to Boston all the time and I didn't know that until this process. So I'm a little guilty, but it's all Greater Boston to us now. So ARPA-H is in the business of taking big bets, and our big bets are towards a future of health that we all want to live in. We have some of our program managers here, Ross is here, Darshak, and so they go through a framework of, they come to ARPA-H for a term appointment, and of course they're incredible doers. They have these great CVs, but they actually have a vision for how they want to change the future of health. And so at ARPA-H, we have a very privileged position to ask, is that a future that I want to live in? And if it is, we take a bet on them. And today we take a bet on Massachusetts. We think you can be part of that team. What was very important to us as part of this whole process was that not only could you rally the local community, but it was critical that you could really rally the nation. And so all of you innovators here know how hard it is to take innovation from the lab and into the real world. You can have brilliant minds to design technologies, but if you don't have the creative and brilliant minds to figure out what are the terms of the contract and the licensing and the IP to get it out there, it's dead in the water. If you don't have that innovation in the communities that actually have this unrelenting vision of how to serve that population down to the individuals. It was really what a privilege to spend the morning at La Collaborativa this morning with Gladys. And then also we went to a manhole with BioBot, got to collect some wastewater and meet the municipal team that was doing that. It really takes everybody to do this. And that's why ARPA-H is here today. Well, we only have 6 programs launched, which I'll say my team are like, that's a lot. I mean, it is a lot. I've been sworn in about a year ago. But we want to create these foundations so when those programs get to their end, that we have a pathway forward to transition to communities and for sustainable investment. It's very critically important. We are modeled after DARPA, the Defense Advanced Research Agency, which brought us stealth technology, which brought us the internet, the original ARPANET, which was 4 nodes. We're starting with 3. And that's really the aspiration of where we want to go to. But at DARPA, I was at DARPA, many of us in this room actually were, when you're successful with a project, the Department of Defense will develop this for you. You have a customer built in. It doesn't exist for health. Health and Human Services, we have some wonderful representatives here today. They're our biggest cheerleaders, but they're not going to manufacture this for us, right? Each of our states have a different approach to how we're going to pay for healthcare in many cases. And so it's important that we create ARPANET-H to be the ecosystem that we can transition to. That doesn't happen overnight. It's going to take some time, but I know partnership with Boston will get us there. We have a couple of VIPs in the room too. We have Thymune, one of our first teams that's funded, our first small business. I think representatives from HMS are here too, under the DARTS AMR program that is really rethinking the way that we diagnose and bring new therapeutics to combat antimicrobial resistance. And so we're really excited to not only be funding this local ecosystem, but being able to help launch into the future. When you think of ARPANET-H, one of the primary innovations that we're bringing forward is how we do contracting. So Craig, who you met earlier, we call him in an endearing way in the agency the chief bureaucracy hacker. So for any of you that have worked with the federal government, it can be a long and cumbersome process. Of course, not working with us here as part of this award, but it can take months to get under contract. And so with the award that we have at the Venture Well, it's meant to be more of like a business-to-business interaction. And so if we want to work with a community or a small business, that turnaround time should allow us to do very quick cycles of even product innovation. So design, test, build, iterate over the course of a project so that by the end, not only do we have the funding lined up, but we also have products that our customers, whether they're patients or healthcare providers, want to enthusiastically adopt. That is unique to the federal government, and it's something that ARPA-H is bringing forward today with the Investor Catalyst Hub. I really want to get to the conversational piece of this, and we really had an opportunity today to spend time with members of the greater Boston community. And, it's really important. So Boston, yes, is a biotech center, but unfortunately, where a 2-mile difference can also mean a 23-year difference in life expectancy. That's right here in this city. And so getting innovation out of the lab and down the street remains a challenge. And so we can start here and really scale this to the country. The Investor Catalyst Hub will really help us close that gap. And so this morning we got to spend time with communities, not only looking at innovative ways to introduce technologies, but the actual innovative technologies themselves. And so I invite my panel of powerhouse women to their seats that we're going to start a conversation. I'll introduce you as you're coming up here. So meet Gladys Vega. She is the executive director of La Colaborativa. And I'll say I felt like I was staffing Gladys today in her community, where she hugged everybody that she saw. They all ran up to her. And, it's really important for us as we launch new programs at ARPA-H to build trust with communities so we can have these conversations. And I think Craig said today, when you're going to ask something really weird about a new technology to somebody, it can't be the first time that you meet them. And so we hope to bring those really innovative new technologies forward. Mariana, you took us today to a manhole to collect wastewater. You're the CEO and co-founder of BioBot Analytics, and we're going to hear a little bit about the innovation that you're bringing forward. And Dr. Ann Kabansky, thank you for being here, the CEO of Mass General Brigham. So I'm going to go ahead and transition. I think my mic will work. As I get over there, can you all hear me still? Okay. Well, thank you for joining us today. We'll have a little bit of a conversation, and I hope there's time for a few questions. Our elected officials, thank you for coming. We know you're busy. Thank you so much. Yes. Great. Okay. So one of the stories that we heard from your community, especially as we were kind of going through this application process, you invited us to think back to March of 2020. And I know a lot of us, of course, remember those moments early in the COVID-19 pandemic where, restaurants were closing. I personally did, I'm not proud of it, did do a toilet paper run, but really thinking about what does this mean for our communities and going forward. And so I really want to kind of go one by one and walk through to look back what was happening in that time. And I want to invite the audience to think about what does innovation mean at the scale that you'll hear from these different panelists, and how might that work for the next pandemic. ARPA-H has a resilient systems office. This is the place that we want to double down and invest in the capabilities and technologies that will prevent or help us be more prepared for that next pandemic or an economic crisis or even climate change moving forward. And so Gladys, I want to go ahead and start with you. So I invite you, we want to bridge this gap between innovation in the lab and into the real communities and innovation on the ground. And maybe you can tell us a little bit about what happened in your community early in the pandemic.
Sure. So Gladys Vega de Chelsea, buenas noches. So for me, it was March 4th. I decided to send the staff home. People were getting sick. We have essential workers that we provide services too, and they were, coughing a lot, and they had a lot of the symptoms that we were seeing on television. So I decided to send them home. Then immediately after, I get a phone call from a truck that is delivering food. He was rescuing food, and he said, "Can you use this food?" And it was March 5th, and I'm like, I don't have no staff. I went home and told my daughter and her husband, "Do you guys mind if I open the porch of our house and have food for the neighbors and they can come and collect?" Surprisingly enough, I did a Facebook page. I'm sitting there with all these boxes of food and wondering what the hell did I got myself into, right? And immediately over 250 people showed up to collect the food. And from there, I knew that there was something happening big in our community because people were beginning to get sick. They were not going to the hospital. They had the symptoms. A community like Chelsea, it's an overcrowded community. We have a 3-bedroom apartment where you have 3 different families renting a room. Why wouldn't a pandemic as COVID-19, flourish there when there's so many limited space? So immediately we gave all the food, and from there we began a pop-up food pantry. What we did differently was that as we were feeding the community, we were inquiring what is going on at home, doing wellness check. In addition to food, what we can do for you. And remember that there was a lot of, this distancing and all that. We didn't care. We worked 16-hour days, and we make sure that although we were feeding, we were also finding out what was happening. And we identified approximately 15 to 20 members of our community that were in leadership position, non-traditional leadership position. The churchgoers. If you were a churchgoer, we hire you so that you can go and knock on those doors, and then people would remember you, and we became trust agents. So I think what was key in our community was that we kept doing wellness check, and we went from, at one point, we were the epicenter of the pandemic in United States. And people, at times, it was very hard to convince our community because people thought that it was cholera. People thought that what Telemundo, said was the truth, nothing else but Univision and Telemundo, the Latino networks. And when we were trying to emphasize the testing or the vaccination, people were afraid because, they didn't believe in it. And what was the highlight of that moment that it was so critical was that we didn't take those no's for granted. We sent those promoters to the neighborhood with all of our staff. We asked them if they wouldn't mind coming back. They agreed. And we knock on doors with homemade masks because we had people making it, not knowing that they were cloth and they didn't work, but we were not scientists, you guys are. But we did whatever it took to make sure that people were getting information. And we didn't stop there. And also, we make sure that we ask the hospitals. It was very hard for me, these ecosystems that are assisting my community, they wouldn't give me information of how many people they were turning down. I wanted to know how many people were getting sick. And the leadership would say, no, Gladys, that's confidential, that's private. We're sending them home. We're not able to do anything unless they have all these other symptoms. And for me, it was a demonstration that data and research is necessary when you're addressing these situations. Because as a strong advocate, I can advocate for those test results to be released and for people to be tested. Because we were getting very, very sick and people were not understanding what was happening. And we lost lots of life, and we are a community that was vulnerable and that was neglected because our social determinants of health are missing in every category. So that's what we did. We knock on doors. When you said not about a vaccination, we would ask, the promoters had a tablet, and if you say, no, I'm not interested in getting vaccinated, we would take your name down and say, oh, no problem. We'll take your name down. And then with our partners at MGB and many other hospitals, we will send doctors with our community residents to go back in that door and knock and say, listen, if you're concerned, we have a doctor. Can she explain, what's going on? Can Elsie, Joe, Betancourt, Julia explain, ¿qué quiere decir COVID? What is COVID? And why is it important to vaccinate? And one thing that I always used to say that I use for El Mundo newspaper, it was, people were so afraid the vaccination was going to kill them. And I said, miren, COVID, las vacunas no matan, COVID mata. So I was like, look, the vaccines don't kill. COVID is killing us. And if we don't take care of ourselves and we don't vaccinate and we don't keep social distance, it's only going to get worse. So we took that lab to our community and the miracle happened. And we went from an epic center to becoming one of the number ones in the state of Massachusetts on most people vaccinated.
So, Gladys, you talked a little bit about data, and especially early days, how hard it was to get. And so, Mariana, I want to invite you to talk a little bit about, what was happening for you in the early days of the pandemic, and thinking, here's boots on the ground. You were in the ground, I think, in some cases.
That's right. So early 2020, BioBot was a 5-person company. All of us actually women, engineers and scientists. And we were actually already on the ground, but testing for opioids. Well, when we began the company in 2017, we were focused on solving and helping with the overdose crisis. So when COVID-19 started in early 2020, we felt compelled to modify our technology in order to be able to detect this new virus, SARS-CoV-2, in wastewater. We had something very good in our favor, which is we had a network, the right network to quickly develop this new assay for wastewater. And adding to the list of the firsts for Massachusetts, Massachusetts was the first detection of SARS-CoV-2 in wastewater of the entire country, and second one in the world by a couple days. The Netherlands beat us to it. But it was possible because we had BioBot on the ground, fully dedicated startup to wastewater epidemiology. We had professors at MIT, Professor Eric Ohm, other universities who were helping us out with the design of the assay. We had the support of Deer Island, the wastewater treatment plant that receives the wastewater from the Boston area. They gave us access. They didn't have to give us access. They trusted us to give access. And finally, once we started to produce the data and we realized that actually it worked, and it worked very well, we had the support of the State Department of Health and the governor to continue the work, to start publishing it, to start talking about it, and to start getting even paid for it, which, it was important for us because we were, again, like a 5-person startup. So we had been like self-funding a lot of that work, but we couldn't really do that for much longer at the time. So that was all pretty important. And the data, remember, was like a little bit scary when we began to share it, because at the time, we didn't have the testing capacity built yet. So there were only like suspicions that we had maybe some cases locally. And then our data, just if you assume some back of the envelope shedding from people, was showing that there were probably thousands of cases already like in the Boston area. So I remember people just paid a lot of attention, and that microcosm of what happened here locally, like the crowd of wastewater epidemiology, then began to get replicated across the nation. We started a movement that very quickly we got, similar to your story, Gladys, we got like a wait list of 400 communities nationwide that wanted to start working with us. It was, I want to highlight again a little bit like the holy trinity of wastewater epidemiology being, you need wastewater epidemiology expertise, you need wastewater treatment plants or DPWs, like this morning, like people who are committed to give access to the wastewater, and then you need the public health side, and all of that is in service of the public. And I think that, that was also pretty important to us from the very beginning. We felt strongly that this data should be communicated very broadly, and that created a lot of use cases that nobody could have anticipated. For example, hospital systems began to look at the data, to plan their own capacity and to be able to accommodate the influx of cases, but also some of their other work. The school system in Cambridge began to use wastewater data as a way when to prioritize in-person teaching versus virtual teaching. people of all sorts began to follow BioBot on social media and through our support email and through our public dashboard. And we have received so many testimonies of, immunocompromised people, people with young children, parents, that just say, your data just means so much to me. Like, I look at it all the time. We began to see policy, like wastewater data, not on its own, but as part of a larger ecosystem, supporting policymaking at the state level, at the city level. So there was just so much goodness from all of that data flowing through society. And I think that is a learning that I hope we can take going forward, that, if we're preparing all together towards this crisis, broad availability of the data will keep us all safer rather than purely restricting it to the public health experts. They should see it, but also many others. So, I'll stop there.
Well, speaking of public health experts, Anne, today we got to see the community van that was delivering healthcare right next to a healthy food distribution from La Colaborativa. Yeah. And so it's really great to see how well this community works together and innovates. But I would invite you to kind of look back at during that time early in the pandemic, and what did your system do to help respond?
So a lot of this is, I'd say, and this relates exactly to what Investor Catalyst is really all about as a hub. It's the galvanizing moment that we had as a healthcare system, that other healthcare systems had, that the country had. What was that galvanizing moment? And it's the kind of thing when you run a healthcare system that you don't really want to hear, which is something is happening. It's very big. No one really understands what it is at all, but thousands of people, hundreds of people are coming in. They're coming into the ED. They're coming in with something we don't understand. No one knows what it is, how to diagnose it, take care of it, and people are dying. People are terrified, patients are terrified, the staff is terrified, and that's the galvanizing moment that took place. And the other part of the galvanizing moment, which gets to a lot of this, is we started meeting every day. We started meeting multiple times a day. And we took what was a system, multiple systems, and immediately created what's the data? What's the effect on people? What's the dashboard? I wanted to see a dashboard of every single one of the 3,000 plus beds across the system. Where are the beds? Where are the ventilators? Who's in the ICU? What's happening? And I was told, this could take a really long time. And I said, absolutely, we've got like 4 days. And you know what? This is what happens when there's a galvanizing moment. And that galvanizing moment was, again, people are dying. We have to get together and get through all of it, the bureaucracy, whatever's going on here, and just get to what we need to do to take care of patients. What's another moment? I get a call and it's like, we don't understand what's happening in Chelsea. Mm-hmm. So many patients in the ICU are from Chelsea. A disproportionate amount of patients are from Chelsea. Okay, so again, among all the learnings is understanding what that actually means, what the effect of this disease is on many, many communities, and it's not the same at all. And you talk about social determinants of health, you talk about the things we learned. I would just say a couple of general things. Number one is it shouldn't take a pandemic to highlight all of the inequities that we knew and know were there for many years. It shouldn't take a pandemic. It really shouldn't. But yet, during the pandemic, many of us learned things that we actually knew all along. Social determinants of health. We talk a lot about rapid change in the cycle, in the continuum of discovery to diagnostics or therapies to people, how long that is. It is very long. That's a very long cycle in and of itself. Then you have the who gets to benefit from these diagnostics and therapies and devices, even if they've been through the whole cycle. And the answer is, it depends. It depends on where you live. It depends on who you know. It depends on a lot of factors. And all of that has to change. So the first thing we learned is you've got to look at the total picture. You have to understand what it means to be a patient, who those patients are, who are our patients, and what are the communities patients come from. And it's a very different way of looking at how we provide care, how we scale innovation, how we have major impact. And it is not everyone comes to the hospital at all. It is, we need to scale it up, have more impact by going out into communities, having impact, and understanding what we're doing. And this point about different places, we had these various messages coming out from all of the various places that public health messages come from, and they were very solid. Wear masks. People didn't have masks. Separate in different places in your home. You have multiple families living in one place. Use hand sanitizers. Nobody has that. So we kept hearing these things which are extremely important and valid. They just didn't apply. So you have to understand, bring care to communities, scale it up, and be nimble. And that was a lot of what we learned. We also learned how to use technologies that were there all along. So behavioral health was an enormous challenge. And yet, right now, and this gets to what we learned and is still there versus what we learn and is not still there, which we may want to get into a little bit later, 85-90% of all behavioral health visits are virtual. That continues to this day. And that's been very, very powerful. But what we also learned is there are a lot of communities that have no broadband access. They don't have access to a computer, don't have iPhones. And a lot of it is in English. So we used multiple translations. We worked on translating. We worked on flip phones. We worked on how we get messages to people no matter where they are. And then I'll just mention two other things, which are how you get innovation across a healthcare system. Diagnostics. We worked out a lot of diagnostics, as did others, in partnerships with others. But how do you bring those diagnostics out into many communities and not just have them in one place? How do you scale it up? How do you have more impact? And how are you nimble about it? And those are fundamental things. Vaccines. We did a lot with vaccines. So did others. Did a lot of clinical trials. That's fantastic. But who's in those clinical trials? And you mentioned that. Clinical trials should be scaled up. People should be able to have access to clinical trials no matter where they are. So there are a lot of innovations that we did as a healthcare system. There are a lot of things we learned. But I think in terms of the spirit of this going forward, it's how do we foster innovation? How do we think about it in terms of who will benefit from that innovation? And even if you shorten that cycle of idea to the science, to the idea, to where we go, to the therapy, to the diagnostic, no matter how short that is, if you can't get that out broadly, there's a whole other lag period for a whole other generation of people who are going to still have a shorter lifespan. So I think there's much to be said about it, but those are just some of the things. And we went from that period of absolute terror in those emergency departments, absolute terror. So people were in terror at home, not going out with masks on. These are the people who were there 24/7 taking care of people, and we came out of it. But there's a lot that we learned from it, and there's still a lot of fragility that's there in those healthcare systems and communities because of it. And those are the kinds of things we need to continue to work on together.
So I'm going to put the audience on alert because we're going to open the floor to questions in a second. But what I would love to invite all of you to do is you've done such a credible job during this last pandemic to start to help build towards that resilient healthcare system. And we have a new office that is built that's really dedicated to this. So maybe 30 seconds each. I'll start with you, Anne, and we'll work our way back, reverse order. What would you love to see? What are you hoping for, whether it's from ARPA-H or in your own community here to build those resilient systems?
I think, again, it's bringing together those groups that came together so beautifully during the crisis. We learned so much during that crisis. How do you bring the right groups together to think about this together? Communities, academic medical centers, innovators, people in biotech, all of these groups, all doing really exciting work, often that no one really knows what's going on, literally across the street. And this is a beautiful example of what you said. You can have a company that's focused in an area with a technology that may have incredible possibilities in a totally different area. But if you don't bring that group together, you don't know. So I would like to see that continued mentality of bringing it together without a pandemic. And how do we work together to think about what's really important in healthcare? And how do we scale that up and work on it together so that it can have major impact well beyond our walls?
You're here. Mariana?
I think that the pandemic gave an opportunity to experiment at very high speed on a bunch of new technologies. And there are some of them, I think, similar to what Annie's saying now, that just clearly are game-changing. They are changing the world, and we should keep building them. We should not abandon them. Mm-hmm. Obviously, like, for example, RNA vaccines, we should be now leveraging that technology to do so much more with it. So many other diseases, wastewater epidemiology. It has the potential to test for so many other things. Like we just started a partnership with another federal agency within NIH to start testing for opioids, for example. So I think that it's important that there are models to keep some of these very winning technologies live and going. And I think that that is going to be something to navigate for, especially the private sector, given that right now the public sector will have the pressure to largely reduce spend on a lot of the programs that were implemented during the pandemic. So then it will need innovation now from a business model perspective for companies to keep these technologies not only alive, but like growing and thriving into more opportunities for the future and in preparation of, the next emergency.
Great.
I can say that for me, the whole thing that we did during the pandemic with all these partners, it was about trust, it was about building community, it was about working together, it was also about accountability, it was also about letting each other know what we were doing right and wrong, how fast those tests were coming or not coming. Where do we, pick up the phone and call the Attorney General so that she can call the Governor Baker? And I mean, we did everything. We named everything. And at times at 9 o'clock at nighttime, I was calling Maura Healey. We worked together for 15 years in the Attorney General's office. And I would call her and cry with her. And I kept saying, I am not a doctor, but my community's dying. And we're not doing enough to save their lives. And I think, Mariana, one of the things that was phenomenal in this project with water management, water waste management, at the beginning when I heard about it, I'm like, how the hell is that gonna happen? And is it gonna work, right? And I was so afraid, how do we tell people, our door knockers, when you found the evidence, go to XX Street, vayan a tocar puerta y go and run over there, knock on doors, because there's an increase of COVID cases. And how do they know that? And how to explain it, And it was incredible, but people believed it. They respected that, and they took care of themselves. And we would go back again and get them tested. And I think that with this designation, what I ask as a humble community member that has advocated in my 35 years at La Colaborativa for social justice, that in order for us to have a healthy community, people need to have a roof over their head. In order for us to create a healthy community, we need to have a better society that truly cares about the health of that individual. And my ideal dream, as you asked, is for us not to have patience. If we do such a good job leading this effort, because we've been designated or we're given resources for you all to make it happen, don't do research in a lab, do research in my community, in our community. Sometimes people say, why didn't you participate in that survey? Why? The answer is that we were not asked. We were not asked. So please don't be shy, reach out, because the ideal situations is our residents don't become patients. I think that's my dream. My dream is that nuestro pobre gente no tenga que tener doctores. They don't have to see the doctors because they're so healthy and because we have done everything right to make a better society. And in order for us to do that, we need to continue to provide and address the social determinants of health. Muchísimas gracias. Gracias.
Gracias. Well, we have some of our program managers here, so you all have a customer right here. Gladys is ready to work with you, which is so exciting. I'll open the floor. I think we have a couple minutes maybe for one or two questions, if there's any from the audience, for myself or for the panel. No? Susan?
Thank you.
Dr.
Again. We're so
Blumenthal.
proud to have ARPA-H here. Thank you. We're so proud to have ARPA-H here, and thank you to our panelists. Gladys, you shone a spotlight on the sociocultural determinants of health. As Senator Markey said, it's not your genetic code, it's your zip code that is so determinant of your health outcomes. So, Renee, how do you think technology can be used to address the sociocultural determinants of health, housing, education, to really kind of create there's a digital twin of an individual, but a digital twin of a community that could really access the services, that could create these healthier individuals and communities? That is your vision, Gladys.
Yeah, it's a tough question, but it's such an important question, and I love the way that you phrased it. How are you looking at that holistically? And so one of the things that we really are leaning into in a big way is AI, ML technology. And so I think that, again, I'm not going to be a program manager anymore. We bring in these brilliant minds, but we do have more and more conversations of, really, how do you even just assess the situation beyond the initial diagnostic or the initial encounter? But what is this patient's overall risk? They might be presenting for something really acute, but how do you really look very quickly, holistically, and maybe even start to predict what is going to be the best type of care? We don't have any program addressing that today, but those would be the types of things that we want to work with the community here, but also program managers that may want to come to ARPA-H that are really emboldened by that challenge that you've just put forward, so they can come and launch programs in those areas. Mariana, maybe you have an idea.
Maybe if I can comment just on my experience. So I think we can gain if we encourage entrepreneurship and innovation from a more diverse set of individuals. Like, for example, in my case, I'm originally from Mexico City, like the slummy part, not the nice part of town, as I like to say. And therefore, just growing up and becoming a scientist, going to MIT, like, obviously who I am at the core doesn't change with that. And I had that deep commitment to service, to help the ones who are not in that, that don't have the same opportunities. And it was very important for me to spin off a company that had mission and social mission and advancing of society together, not just the 1%, as part of the vision. So, I think that it's part of diversifying the set of entrepreneurs, because they will care about different things. I think it's about also designing technology that is accessible from day one to everybody and not just the 1%. Because when you're building a company, very early on, there's this fallacy that says it's okay to design for the 1% because over time it will get so cheap, everybody will be able to afford it.
Right.
It's I'm sorry, but no. I mean, it really hasn't worked like that. I feel like if you want to design for the 99% rather than for the 1%, there are different choices that you make. So maybe just BioBot, for example, we work with Chelsea since 2020.
Yeah.
Not just with cities like Cambridge and Boston, it was just really important for us to work across the board.
I love that you brought that up, because in our the framework that we launch our programs, the program managers answer these 10 questions, the How-Meyer questions about, what's the problem you're trying to solve? How's it done today? What's new in your approach? But we also ask the question, how are you going to address costs and accessibility? And by doing that up front, you have to fundamentally have a different approach to how you design that and how you deliver that and bring that to communities. We hear feedback, that's really hard. We'll do that later. No, you won't. You're going to do it today, day one. And if you're solving for that hardest case, everything else should just be easier, right? And more affordable. Or at least that's the approach that we want to take by design. So I think we take one more question if there's one in the back.
Thank you so much to everyone on the panel. I'm Willie Reeves with Celino. We're a cell therapy technology platform company based in Cambridge. So many companies in the Commonwealth are working on amazing health innovations, and I think the work that ARPA-H is exactly what's needed at this moment. As we think about treating disease, curing diseases, how do we start to think about health span more broadly? Right? There's the question of lifespan and how do we, for example, address someone not getting COVID-19, but how do we, during a patient's life or a non-patient's life, how do we think more broadly about health span and making lives last not only longer, but have higher quality during those lifespans?
invite panel if anyone wants to jump in, or else I'll.
I mean, I could just start on a couple of things. I mean, we talk a lot about this question of lifespan, health span, and what that actually means. And part of it is really trying to understand what health is. And it gets into so many different areas, but it is really the continuum of health, which is not what is done in American healthcare, or I'll just comment on that. A lot of this is episodic illness, and that's what we see. I mean, that's what we see, and that's what comes to most acute care hospitals. It's episodic, it's episodic, it's episodic. I'll say it a couple more times. But the whole continuum of health, and this is really what you're getting to, what that really is defined at from beginning of life to end of life, how we monitor it, how we individualize it, and that gets to capabilities that might, we always talk about personalized medicine. There are many dimensions to that. Some are not really very useful, and some are, but it's really a personalized approach to what health is across the entire lifespan. We don't think about it in that way. But I think that is one of the challenges. What defines health? What's acute illness? What are the different stages of life? What happens at end of life? All the way through. So I think again, it's a different way of approaching things. So that continuum of health really brings in all of the kinds of things we've been talking about. And it's looking at health as life in a very, very different way. It goes from patients to people. Now you could say, well, what's the difference? Patients are people. It's of course true. It's just a different way of thinking about it. So there are lots of different approaches you can take, whether they use AI, technology, but I would just stop by saying it's really a philosophical approach at how we view people is what it comes down to.
For us at ARPA-H, were you going to jump in? Please, I'll close this out.
One thing that I wanted to address is a perfect example. This morning, there's an elderly person waiting in line for the food that we distribute twice a week. We're still distributing food at a food pantry right across from the building that we're renovating, and he passes out. And he passes out because he has been waiting to get in the food line for 2 hours. 2 hours. And why did he pass out? Because he had nothing to eat at home, and he was waiting for us to feed him. So for me, that basic need that an individual person has is what has to have us change the way we do medical and the way that we create, build healthy communities. And that is why it's so important for this ARPA-H to happen in a place like Massachusetts. Because Massachusetts, although people think that we're very sophisticated and everyone has a lot of money, in communities of color, that is not the case. That is not the case. And in order for you, if you have to wait 2 hours in order for you to get a box of food that is probably $150 worth of, food items, and then go to a house that may not allow you to cook it because they don't give you permission to use the kitchen because you're living in a shared apartment with a master tenant and you are a subleaser, illegal subleaser, you may not have access to that kitchen. So I think that, we all have to think creatively on how are we going to address, the quality of health of our individual members, because at times that's not what you all see. That's what I see. That's what you have seen. That's what you doctors report back to you. And that is why sort of like these local clinics in our community are so important, and these labs, to get out of a lab and to come to Chelsea and study the way that we study COVID. COVID happens in Chelsea, Massachusetts every day in different aspects, right, of medicine. So, think about that as we're creating ways to build better communities and healthier communities.
And really, I'll just close with at ARPA-H, our mandate is from the molecular to the societal. These are the challenges. This is the span that we're going to address. We talked about the resilient systems focus area, but we have another focus area, proactive health, because we think our investments can really have an asymmetrical impact on the ecosystem. What do I mean by proactive health? This is our focus area that prevents people from becoming patients in the first place. This is, diagnostics detection, but also, mental health, behavioral health, and how are we going to advance programs in those areas to start to get more at some of these social determinants? Well, I feel inspired by all of you, and I am just so excited to be here. The examples that you've set for your communities is just incredible, and it's going to be for us and our program managers. I learned so much today, and these immersive experiences and connections to the communities is what's going to, our program managers are going to go back to the drawing board as they're building their programs and really work not in isolation in a lab, but in partnership with you. So again, thank you for that. Thank you for being here today with us.
Thank you.
Great. All right. Thanks. Okay, I know we're going to turn into pumpkins here soon. We're going to have to leave this site. But I just want to take just a quick moment. One more thank you to the team for hosting us here at Mass Challenge. I also want to say a real thank you to my team. So the whole ARPA-H team that has come together, and I would be remiss before I let you go to tell you a little bit about them. So I've been in a few startups, and being in a startup is hard. I actually have my old team from my last time here as well. So these are the bonds that you never break, right? Because you go through a lot of stuff together, and. But I will say, building a startup in the federal government is not for the faint of heart. It's very challenging, and at the end of the day, it is the mission, the communities that we serve, and it's also the team that helps you get through it. So for the ARPANET in particular, the team that's represented and led by Craig Gravitz. Where'd Craig go? There's Craig. Craig is here. Your team, I know we have Dan Bram, still from the last startup, brought to this startup, but folks that really know how to think about scale and bring this innovation forward. Joe, our recovering surgeon turned COO, which Chief Operating Officer. It's kind of, you're still in it. And our program managers, we're very quirky on our team. Program managers that are here to launch programs that we're really excited about. And then, so Jenica, there's so many team members here, people that have lived the DARPA life and want to relive that. And I remember being at DARPA with you being like, we can't fund this because there's a big D in front of DARPA, but I know that we can really make a difference. And so the energy that was in this community to really launch ARPA-H, it's really ours to harness. So I did say that my team is quirky, and so as we plug in ARPA-H, we're going to do that metaphorically, but also literally here tonight. And so if you'll kind of join in a little bit of our quirkiness, I'm going to count down from 5, and then you'll help me plug in the ARPANET here in the Investor Catalyst Hub. Okay. So I should say this plug was provided by one of our spokes. So the Jefferson Design Lab in Philadelphia has very, very helpful tools to help students learn about medicine. But today you can see that the Health Design Lab on the inside of the plug. You can see ARPA-H in there. But this is just really fun for us to close out this big event. So I'm going to count down from 5. Please join me. 5, 4, 3, 2, 1. Thanks, everybody. Have a good night.